Forward to the cloud, and then I'm going to let everybody in. Awesome. You've got a great group coming in today.
All right, sounds good.
We are so excited you joined us. And thank you, thank you, thank you.
My
A
pleasure.
thousand times over.
I look
Well,
forward to it.
absolutely. I'm going to go ahead and get you started. Welcome, everyone. Come on in. Come in the room. We are excited to have you here. Thank you, Michael. I'm good now. They got me in. I
Yeah, I just
appreciate
saw
it.
that. Okay.
Thank you. Welcome, everyone. We're going to give everybody 1 or 2 more minutes, and then we'll get started. Welcome, welcome. Thank you guys so much for coming in. We are excited to start this conversation. I will make my introductions to Mr. Romero, or Dr. Romero. I apologize. Dr. Rocky Romero is a social worker, and his topic today is cultural considerations for addressing mental health issues in Hispanic and Latino children and youth. This is a great topic. Dr. Torres got us started with our appetites, and so we're so excited that Dr. Romero is here to share with us. He has several accolades. He is a former assistant professor at New Mexico Highlands University School of Social Work in Albuquerque. He served as the co-chair for Governor Richardson's appointment in New Mexico Higher Education Department on Cultural Competency Task Force, as an executive council member for the New Mexico Consortium for Behavioral Health Training and Research. He completed his doctoral studies at the University of New Mexico in language, literacy, and sociocultural studies. Ooh, that's a good one. I may have to adopt that program, just to tell you. Focused on analyzing legal discourse through a critical race theory lens. This is going to be dynamic. Let's let Dr. Romero give him a hand and get him started. Take it away, Dr. Romero.
All right, thank you, Constance. I appreciate that introduction. And welcome everybody to the presentation this morning. I'm following up with Dr. Torres, so I have some big shoes to follow up in, and I want to really say thank you to the National Hispanic and Latino Mental Health Technology and Transfer Center, and of course our host for having us. Thank you so much for hosting us today. We have a good presentation. I don't have a lot of time, about 45 minutes or so, I believe. So I do want to give some folks a little bit of time for questions if you have that. And I will share my email address. So if you want to follow up with me directly, that would be fine by me as well. So I'm going to go ahead and jump into this since we don't have a lot of time. I'm going to switch over to my screen here. And you all should be seeing at this point slideshow. So thank you to UNT Dallas, July 22nd, here we are. Today we're looking at cultural considerations for addressing mental health needs of Hispanic and Latino youth. I come at this from a very much from a critical race standpoint and really looking at access and opportunity for Latino and Hispanic youth to gain support for addiction, substance use, and some of the other issues that we see relative to prevention. Today, you'll also hear me touch and highlight a little bit also on the importance of us recognizing suicidality as a huge disparity in the Latino population and something that we need to address, moving forward. So I won't go into all this. Thank you to Constance for introducing me. I want to start by saying the MHTTC network and all those affiliated, these programs are 100% funded by SAMHSA. So if you're not aware, our center oversees Hispanic and Latino issues and mental health, but there are also 9 other centers regionally in your area, usually connected to a university where they will also be able to provide you additional support. I think in your neck of the woods, it's the southwest, if I'm not mistaken.
Yes, sir, you're all correct.
Yeah, thank you, Constance. Yeah, so we definitely come from the standpoint of the utilization of language that is strength-based, obviously trying to transcend and infuse hope within our messages. We definitely see that we want to make this respectful, clear, and understandable while being inclusive and accepting of diverse cultures, genders, and perspectives and experiences. We definitely come from this work from a trauma-centered approach and focus, and we want to make sure that that is respectfully and reflected, that it's clear and understandable through all of our actions, policies, and the products that we produce, including this one today. So our objectives: we want to identify trends in mental health disorders, including suicidal thoughts and behaviors. We want to definitely discuss some cultural specific risk and protective factors associated with mental health in the Latino community. Then we also want to see how can we really pay attention to the language we use in order to improve mental health among Latino youth. And a lot of times that is using language that is inclusive, right, rather than exclusive. And I don't get into it so much in this presentation, but when you think about it, it looks like language, when we talk about dichotomies, the us versus them dichotomy, right? Where we see a lot of language that really identifies people of color or BIPOC, right? Our Black, Indigenous people and people of color in a very negative light. It usually separates people out, again, using us and them rather than we or us together, right, as a community. So we'll talk about that just a little bit. Some of the disparities that we look at, and this is from the Centers for Disease Control, 33% of Hispanic students experience persistent feelings of sadness and hopelessness. Now, you can look at that at from a number of different lenses. If you're looking at it from a more of a systems lens, right, you may consider what are the systems that young Latino are involved in school systems, maybe community programming, maybe some sort of community events, organizations that may be religious or spiritual based. So we look at those systems, and also community and family as another system part of that, right? How do we see that creating hopelessness and sadness in our communities? We definitely have to say that most of these folks, again, the 33%, typically will initiate alcohol use, cigarette use, and other drug use to help to address some of those feelings that may be new to them. And one thing that I want to talk about, and we'll touch on this later, is anxiety, right? We see anxiety being a symptom of discrimination, a symptom of oppression. We see these factors coming into play, especially with folks that have immigrated to this country. Most recently, given the state of our government and the way that our government portrays Hispanic and Latino immigrants, usually as criminal, usually as illegal alien, usually as other, right? As Bell Hooks talks about, the margins of our society are those that have been pushed to those margins and have been created as the other, right? That is what we're talking about when we look at Latino, Hispanic, especially those that have immigrated to this country most recently, or even first or second generation. I myself am a native New Mexican, was born in this country, and I still get looks and questions as if I wasn't born here. Questions like, where do you come from? That sort of thing. Or you speak English very well. You learn English real well. Well, I hope so. I attended all public schools in the United States. So, and I was born here. So it really is about, when we look at critically analyzing the systems in place, it's also looking at those systems and how they categorize, separate, and sort people of color usually, right? And usually those groups are sorted and pitted against each other to become in conflict with one another, so that we're distracted with that instead of the true power that lies within those that are in power and in control. We do see that Latino and Hispanic adolescent kiddos are half as likely as white children to use stimulants to treat disorders, such as attention deficit disorder. So that really kind of steers us into where we start to see what substances more specifically are our Latino adolescents engaging in use with. And we'll see some of that here in just a little bit as well. Excuse me. We definitely see, and we don't want to totally separate. And one thing that I always try to do with my presentations is we don't want to pathologize Latino and Hispanic youth either, right? We don't want to separate them out to totally say, because they've had this and this experience, immigration, acculturation, etc., doesn't mean that they're experiencing disorders different than their counterparts, right? It may just be more exacerbated. It may take us more work to getting to what is the root cause or the etiology of the disease or the disorder or the presenting problem. Many times when we see children presenting with generalized anxiety, it's typically when we kind of scratch away at the surface, when we get down to it, it comes down to them reporting feelings of being discriminated against or oppressed or feeling like they've been treated racially or racist in some ways, and they don't know where that feeling is coming from. We definitely see that inequality puts our children at higher risk for more persistent forms of mental health, especially when we look at adverse childhood experiences. We definitely have to see that that increases a child's potential to have disorders into adolescent and further developing into adulthood. We definitely see that Latinos are less likely to seek mental health treatment. That's why we come to you as providers to hopefully arm you with the best information so that once you do engage Latino families and youth, that you connect with them and you bring in a way culturally that can really seem as though you're connecting and you're considering things maybe that others have not. So these are some of the common mental health disorders. Those of you in your state or in Dallas, I can't recall the youth risk and resiliency study or youth risk and resiliency data is really a good set of data to look at. If your schools have participated in that research, then you will have a very clear indication of the areas that youth are presenting in, especially when we're talking about Hispanic and Latino youth. Those are presented like generalized anxiety disorder, depressive disorders, post-traumatic stress disorder, substance use disorder. We also see a lot of adjustment disorder, and also I would add to this list attachment disorder, right? Where young people in their immigration experience, in their acculturation experience in the United States, maybe their relationships with adults have been fractured. So they tend to not want to build those relationships because of their experience with those relationships ending or being separated. Now we see young unaccompanied minors at the border of our country really being separated, and I see the potential for a significant increase in attachment disorders coming as a result of that. Being separated and pulled apart from families is not a good outcome usually. Symptoms of the depression include unusual sadness or irritability, even when the circumstances change, a loss of interest in activities, changes in weight, shift in sleep patterns, sluggishness, maybe self-image issues. When we look at body dysmorphic disorder, etc., we see that playing out a lot more within the Latina population when we're looking at that through whether it's eating disorders as well as other sort of suicidality behaviors, given some of these symptoms of depression having a correlation with suicidality. Feelings of worthlessness and hopelessness, and then thoughts of or attempts at suicide. Some of the anxiety include trouble sleeping, complaints about stomach aches. That's what we see a lot of physical symptomatology presenting as a result of young people experiencing anxiety or depression. So headaches, stomach aches, butterflies in the stomach, not knowing what the root cause is, but it's more generalized. There may be an avoidance of situations, exhibiting clingy behaviors, or even taking steps back where the child may be in adolescence, and at that point, going out and seeing what sort of boundaries that they can push. When we see them regress and go back and want to be very much next to parents and kind of clingy, as it says here, then we have to question that there may be something going on, because usually with adolescents, they want to get as far away from parents as possible, usually in those developmental stages, right? So trouble focusing in class or being very fidgety. So we definitely see some truancy and people skipping class a lot during the school year. And then we can also see this progressing to more disruptive behavior and explosive outbursts if we're not addressing this early on. But definitely includes some self-conscious behavior as well. Latina teen suicide rates, and I think it was important for us to just throw these slides in there because we see that from 2017, we looked at, or the Center for Disease Control looked at people ages 10 to 24. 1 out of 10 Latinas attempted suicide in the last year, or 10%, right? 2 out of 10 made a suicide plan. So progressive steps of leading to potentially taking their life by suicide. And then half said they felt hopeless. So when we see this word, what are the things, and that's one thing that I ask you to just do some self-reflection on. What are the things that our agency or the things that I do personally in my direct contact with Latino young people? What do I do to increase hope, to potentially lend them maybe a vision of my hope, to transcend hope, right? From a in the moment type of experience, but also projecting into the future, having hope for their future opportunities, whether it's job, whether it's getting a going to school or higher ed, etc. Really helping them to create that, and then lending them a lens sometimes of your hope for them and the potential that you see in them. I think is really a prevention and intervention approach that we see very useful with Latino youth. Some of the warning signs that we see around suicide, and this comes from the Child Mind Institute, and it's recent, good information. Isolation from friends and family, problems eating or sleeping, mood swings, reckless behavior, dropping grades. So things that we see is really good attendance and um, um, really an attention to school early on. And sometimes kiddos will experience trauma, they'll experience maybe racism, experience other things from the systems that they're involved in, to where we see a decline in their grades. We see a progression or increase of truancy or skipping school. We may see some flirting or increased use of alcohol or other drugs that is outside of the normal experimentation period for young people. We also see giving away of belongings, talking about feeling hopeless or trapped, being a burden, or talking about being a burden to their family. And then, of course, talking about suicide or wanting to die. Those are direct, obviously, signs that we have to engage in and really get into. Drawing or writing about suicide or acting it out in a play. We definitely see Latinos as being, when we talk about traditions and history, oral history is a significant part of many people in the Latino population's experience of telling family histories, pushing those things forward. And sometimes that can also be in the sense that some young people will journal or write down their feelings. So I think it's important to really ask about that as well. And then we see this increase, right? Especially from 0 to 5 or 0 to 9 ages here on the bottom left, all the way to 15 to 19. We see that spike, right? Where they're 4.5 um, times more likely. And this is important and significant for us because, again, if we're not addressing these issues in adolescence or young adulthood, potentially these will persist into adulthood, and they may end up where somebody does end up taking their life by suicide. And there may have been signs that we could have seen in order to intervene with them as well. Here again, we see the means of suicide, and the number one means is suffocation, and usually this means by hanging. Typically, the suffocation is usually for Latinas or young girls is by hanging. We do see some poisoning, very rare firearms compared to males, as you see. Um, Poisoning, maybe an increase again here with regard to pharmaceuticals, especially with the integration of fentanyl. It's hard for us to know with those individuals that overdose on substances, were they truly attempting to take their life by suicide, or was it an accidental overdose that led to their death? So those are some questions that we really want to look at, more in depth as well. So I would very much encourage you to go to your region there in Dallas, look at your surroundings. Obviously, in the more populated metropolitan areas, we're going to see these numbers go up significantly, and we definitely want to do what we can um, to curtail those. And this is just more information. Again, the youth risk behavior surveillance, and then the youth risk and resiliency study is one that is really good information that kind of plats this out. And we can see female suicidal ideation, 25%. They're at the top of this list compared to their male counterparts. So it's important that we take this for what it is, but again, dig down deeper and look at it through your lens at your region and your areas. We're going to get into some of this vulnerability I think we definitely want to make sure that I connect this to more of the cultural aspects that I'm going to share with you guys. So I'm going to move forward on this slide. I will, or you are able to access this presentation and potentially seek out information if you need to seek out further training on this as well. And I think, Constance, I'm not sure if you have something there. Yeah, go ahead.
Yes, so you have a question in the chat, and the question from Wendy was, do you feel there is a particular reason that hanging is so popular?
I don't think that there's a specific reason other than typically we see females using less lethal means, and maybe not lethal, but less violent means. And I think it probably is just based on gender specific fears, I would say. And then I also think the accessibility. Unfortunately, young people, and people who are dead set on looking at ways to take their life by suicide, we definitely see those individuals having access to belts and ties and definitely more accessible means when we're talking about hanging and strangulation. I think is another reason that I would kind of correlate that to as well. Good question. Thank you for that.
Thank
So
you.
now we're good. Yeah, you're welcome. So now we look at the work of Goldblum, Floyd, and Monger. They look at kind of dividing this into four factors: cultural sanctions, minority stress, social discords, and idioms of distress. So we're going to look at those here, looking at my clock about 9:20. So we'll go about 25 more minutes, and then we'll see if there's any additional questions. Please feel free, and I'll do my best to continue to check the chat there if anybody else has questions as we move forward as well. So when we look at this, the three key concepts that we want you to think about when we're looking at cultural theory specifically is looking for what are different signs of suicide, cultural idioms of distress, and we're going to give you some of those. Two, suicide may be precipitated by different stressors, minority stress, social discord. So when we look at minority stress, what is the client's experience with immigration? Are they first generation immigrant to this country, second, third, fourth? In addition to acculturation around minority stress, ambiculturalism or biculturalism can also add to that minority stress. And then when we look at social discord, my doctorate degree is in language literacy, social cultural studies. So it's really looking at the language and analyzing the language that we utilize to describe, to recruit, to label people of color, especially Latinos. And a lot of times the social discord in our country is very negative towards people of color and especially immigrants to this country, especially with the prior 4 years with Mr. Trump there leading the White House. The language that was used to describe immigrants to our country, asylum seekers to our country, was very derogatory, racist, and inappropriate. And we see that creating more division. And then look for the meaning of things. Cultural sanctions. Cultural sanctions may be reflected or connected directly to the cultural values of a community or of a family, but they also can relate back to what are the cultural sanctions also connected to religious or spiritual beliefs, right? So we have to really pay attention to that and really understand what those may look like for families that you're dealing with. So they may look different in different communities. So I have this broken down a couple of different ways. So cultural syndromes, these are groups of symptoms that may occur among individuals in specific cultural group, communities, and contexts. So imagine if you're a school in the community that would also be taking on unaccompanied minors once they transition from these, to, in my mind, prisoner of war camps at our borders that are taking in asylum seekers, separating them from parents, and then putting them into schools, families, or other. Those groups of individuals may experience very similar symptoms given their unaccompanied minor experience at the border, right? So that's just one example. Cultural idioms of distress, and that may look like ataque de nervios, attack of the nerves, or nervousness, anxiety. Cultural idioms of distress are the ways that those symptoms are expressed. So nervousness, are those shared in collective ways? Are they shared in ways that is created a anxiety about law enforcement, um, about other entities that way because of their experience as a collective? And then also, what are the cultural explanations? So this really gets down to the etiology for the symptoms, illness, and distress. And those may be attributed to cultural explanations like susto or fright. Mal de ojo is evil eye. And we'll, I hope, be able to talk briefly about some of this. And I see another question here. Do you feel that social media contributes to suicide among Latino youth? I don't think that social media, I think the messaging in social media does. I do think that social media has a significant impact on acculturation rates, and the rapidness of young people acculturating at much faster rates than their parents or grandparents or adults who may be raising them. So with that said, we have to understand what social media sites are they going to and searching, and what messages are they receiving about their race, about their culture, about them as Latinos or as Hispanic or as immigrants to this country. So I think definitely social media is a huge, powerful tool. Now, it can also be a tool that really does perpetuate or trigger disorders for individuals. So some of the things that I train therapists to also look at is try to gain the respect and trust of your clients, your young people, the adolescents that you see, in order to hopefully be able to ask them, what sort of websites do you go to? What sort of information are you consuming? Think about all the ways that young people are receiving messages contemporarily. And we have to see that all those messages are not necessarily favorable to them or their race. Okay, so we're going to move forward on this. And it's really important that we see that APA also references some of these cultural syndromes, idioms of distress. One tool that I will share with you that is very important is the cultural formulation interview. That is available in the DSM-5 towards the back in the appendices. And it's something that you can definitely adapt to use as a screening tool for families or individuals that you are seeing that are coming from an immigration or acculturation experiences. So ataque de nervios, this is characterized by generalized anxiety, symptoms of intense emotional upset, may be exacerbated and displayed like screaming, shouting, crying, trembling. Sometimes people will experience dissociative experience, so almost seizure-like or fainting episodes because of the anxiety. Mostly it occurs as a direct exposure to stressful events, typically within the family, but like I've said, it can also be that people are experiencing that because of the social media that they're consuming. Now, one thing that I would say, and there is another really good reference for you that is called Race, the Power of an Illusion. And it's a video. If you do a Google search, I'm sure you'll find it. I think it's a 3-part video, but it talks about how people that immigrate to this country from other countries in their home country may have been healthier physically, yet when they come to the United States, they tend to start to decline in their health, whether that's because of anxiety, because of racism, because of not having a social circle as they once did. Maybe it's because they're pulled from their cultural belief systems. So we want to make sure that we understand that there may be history related to the stressful events, not necessarily always family as well. Nervios and some of the idioms explained more in detail can exhibit symptoms as are listed here: irritability, stomach disturbances, sleep difficulties, inability to concentrate, trembling, tingling sensation, dizziness. Susto or fright. This is attributed to a frightening event that causes the soul to leave the body in a cultural explanation and results in unhappiness and sickness. This syndrome may occur with somatic symptoms. Typically, this has been more prevalent in individuals immigrating from Mexico, Central America, South America, and the Northern Triangle area. And usually it is part of, and I really obviously connect this to post-traumatic stress. This is usually an experience that people will reflect on as they've immigrated to this country and experienced violence along that journey, whether that's experiencing rape, whether that's experiencing direct violence from gangs, or pressure from gangs to join their gang in order to be smuggled across the border and to be human trafficked into this country, right? So there's ways that susto comes a part of things through frightening experiences. And when we look at informed trauma, trauma-informed care, I'm sorry, we definitely want to see this as a part of that connectedness when we're doing cultural formulation interviews for individuals, explaining this as a situation that they're going through. Mal del ojo, or the evil eye, is considered an illness transmitted by making eye contact with someone, as it is received through the eyes of the intended recipient. The instigator frequently covets the victim child, and when the illness is passed, it heats the blood of the victim, thus causing multiple gastrointestinal problems. This is something that curanderas and healers in our community in this region, and I'm sure obviously in Texas and in your region to a certain degree, still practice through cleansings or limpias. They'll do these cleansings that help get rid of the evil eye. I speak firsthand from this experience. My mother experienced this in her childhood or infancy. And my grandmother tells this story often, or told us often when we were growing up, about the fact that my mother almost passed away because her fever was so high for almost 2 or 3 days that they thought that they were going to lose my mom. And part of what they believed, after going to medical doctor after medical doctor and not getting any sort of result or resolve from it, they went to a curandera and they did what they call the egg ceremony, and they resolved the fever in my mother, and the gastrointestinal problems they subsided, and she healed. And it's typically when we talk about jealousy or envidia, where people and people from the Latino or Hispanic communities, when you see them introduced to an infant, or they meet an infant for the sometimes, especially our elders, they'll put the sign of the cross on the forehead of the child as a means of protecting that child. You'll also see infants wearing coral bracelets at a very young age, infancy, like I said, and usually it's meant for warding off evilness, and that's where the coral comes into play. And I know within certain cultures around the country, not just in New Mexico, but in Texas and down into the Mexico region, we have a lot of these belief systems that continue to play out in many people's experiences relative to a holistic approach to their care. So minority stress, cultural minorities, acculturation, discrimination, related strain, or social disadvantages. It may also be attributed to mistreatment, harassment, discrimination, and racism, which may lead to increased risk of suicidality. Acculturation stress, I touched on this. I won't get too far into this, but knowing that acculturation, we definitely want to make sure that we understand that young people are acculturating at a much more rapid pace than their parents or elders or adults that are raising them or that are their caretakers. So that means we have to understand what sort of messaging they're consuming. Acculturation stress can also be one that we see young people acculturating faster and becoming bicultural, if you will, to American and their home country culture. And that may be a stress for the family as well. So we definitely want to see that. And again, that may create gaps intergenerationally that we have to address. I'm sure many of you can attest. And really, if I asked how many of you are currently seeing families that young people are being raised by grandparents, right? Grandparents raising grandchildren, I'm sure we would see a significant amount of folks indicate that that is happening for them. Yeah, Constance, we have a hand up. Yeah.
No, I was just answering your question. How many?
Oh,
Well, yeah.
gotcha. Thank you. Yep. Thank you for that. So some of the acculturation strategies that we see. The intersections are extremely important, right? Multiple factors related to acculturation during an adolescent's life experiences. So we want to try to promote integration. We want to promote assimilation. Now, I want to be careful with assimilation, right? Because assimilation can be something that is very oppressive and also can be seen as very discriminatory. However, we have to take it based on the client and family's willingness to assimilate into American culture and into the ways of the United States. But there still are ways that you can preserve culture from people's home country and balancing that. We definitely see, especially appropriate to address separation and marginalization, biculturalism and ambiculturalism, as young people are really the ones that start to get involved in different systems within their communities as they acculturate. So they may be involved in one, two, maybe three cultures when we look at that approach and that trajectory. Minority stress, we also have to look at what are we doing as agencies to address this within our agency policies, community-based policies, institutions, and daily interactions that doesn't create more minority stress. Obviously, a significant minority stress is racism, anti-immigration laws, not really having pathways for people to what we say as the United States is do it legally, go through the appropriate process, do all that, right? And that's great, and we do want people to do that. But when that process takes 5 years, 10 years, 15 years, 20 years, that to me is unacceptable as a country that seems and projects as though we are so progressive in our thinking and our acceptability of other groups of people. We have to think about that. Really, we don't have any immigration laws right now that really looks at protecting immigrants in some ways as well. Cultural sanctions, Chu defines this as the values or practices conveying messages about the acceptability of suicide or mental health. Suicide is the one that Chu relates to, but we also have to consider mental health and addiction, right? What are the things that we can see that increases accessibility and potentially use of substances or the creation of mental health issues given somebody's experiences. Social discord, again, though that may be connected to mental health, suicide, or addiction risk factors, and it may look like alienation, conflict, a lack of integration with one's family, community, and friends. And then we definitely have to see that many people, sometimes we just have to dig a little bit deeper, also come with protective factors, right? Their cultural values, their family together, other things that we see as obviously their resiliency, their ability to continue to push forward despite great adverse experiences. So we want to increase the protecting factors in the community while we reduce mental health conditions and obviously substance use disorders in addition that may lead to mental health disorders. The role of the family. Latino families in the US will have a negative stigma towards mental health usually, and it's usually because in their home country, there's not a lot of opportunity for that sort of service. And we definitely are raised as Latinos and Hispanics as keeping things more within our family as opposed to putting dirty laundry or airing our issues with others, with strangers, etc. We definitely see family members at times sharing medication or medication that wasn't taken fully by the identified patient, maybe passed on to another family member to hopefully resolve some of their issues that are going on. We don't want to see that, but we do see that that may be something we have to address. And then we definitely see the value of familismo or familiarism, family, as a key element to the forefront of care for our clients from the Latino and Hispanic populations. We definitely have to get a sense as we're doing our cultural formulation interview and doing our intakes with clients, what sort of role does religion and spirituality place? It may be a fatalistic view that has them believing that because of their family's issues or because of their own misbehavior or bad behavior or whatever they want to label it as is creating a punishment from their creator, so to speak. So because I did this, this, and this, now I'm experiencing this because that's the cross that I have to bear, right? You hear people from the Latino and Hispanic communities talk about that a lot. When we talk to them about their mental health or issues that they're dealing with, they say, it's something that I have to deal with. It's my cross, right? And what they're saying in that, it's the cross that they have to bear for whatever reason they feel. Now, fatalistic outcomes is also a part of when we look at the Virgin Mary as a symbolic figure within the Latino community. or La Virgen de Guadalupe, we see that many times young women and women in general are tried to be held to that same sort of saintly Virgin Mary or Virgen de Guadalupe. Um, and obviously we fall very short of that as humans, right? So sometimes when that is something, or the Virgen de Guadalupe is used as a symbolic meaning for families and something for young women to try to look up to. Sometimes we put an extraordinary amount of pressure on young people to be almost saint-like, if you will, which is you know, in my mind, impossible. Traditional roles within families is very important as you're going through this. Machismo or Marianismo. We also look at patriarchy or matriarchy. We see that a lot of indigenous communities, not only Latino or Hispanic indigenous, but also Native American communities indigenous to our region, will most often follow a patriarchal approach. I mean, a matriarchal approach, meaning that the mother is at the forefront of the family, a caretaker. However, we've also seen that those indigenous communities also adopt patriarchal type of approaches when we look at their council members, when we look at their leadership, right? It's usually males in those roles, and sometimes females aren't able even to try to seek those roles because of their cultural beliefs and traditions. Now, machismo usually gets a very negative connotation in the Latino and Hispanic male population. Machismo can be very abusive if people are exhibiting machismo behaviors that are abusive, controlling, overbearing, those sort of things. However, machismo can also be a very protective role, where the male typically can be in the role of provider, demonstrating strength, self-reliance, and control. One thing that I will mention here is that sometimes when a father figure is absent and it's a single mother raising young people, and there is a young male within the family, we see sometimes young male Latinos trying to take the lead as a male role model and almost like a father figure. So doing a lot of family work around role recognition, around appropriateness of roles is very important. We don't want to see young males taking the role of a father, right? That's not their role. That's not their job. We want them to be young men to learn those sort of behaviors and skills that go with that. So we don't want to parentify or put our young Latino males into a role where they're a parent or they're seen as such. Family and spiritual connections to Marianismo definitely are the pillars of Mexican American Latinos, especially. This is something I mentioned earlier, or they're virtuous or chaste, subordinate to others, self-silencing pillars. Again, this is where it starts to connect a lot more to religion and spirituality. We definitely want to involve the family in any work that you do. Sometimes we have to invite the family, a formal invitation. Many times Latino family members, adults especially, will sometimes feel like they're getting in your way as the professional of the work that you need to do with their family member. And it's important for us that we clarify that and say, we appreciate your respect for us as professionals, but we want you to be a part of this. You are integral to the success of improving mental health conditions, and understanding from the family view, what are those conditions that we attach meaning to, like we've talked about today. Show respect. I think that's for all cultures, respeto, right? Or respeto, important in all cultures. It's important to expect that we have a warm and personal interest, and it can definitely increase our engagement in that therapeutic process by showing respect and having more of a collaborative approach rather than a hierarchy or tier, or a top tier down kind of approach when we look at our care. Get personal. I have simpatía or kindness, right? Showing that personalismo or getting personal with clients is important as appropriate to yourself in comfort and obviously your agency policies. Collectivism. Definitely we see Latinos functioning really well in groups and doing a lot of things communal, and we want to build upon that in order to increase balance and harmony as a collective. And then last but not least, these are just some ways that what we've seen is that sometimes we have to think a little bit differently about the way we ask questions, especially around these kind of topics that are can I say, typically taboo areas for some cultures in the Native American indigenous cultures in our community. And in New Mexico, for those of you that aren't aware, we're surrounded by 19 pueblos and tribes in the region. So we have to be very aware of how we word and how we approach things. And I would say for your communities, indigenous or those that come from communities that are first generation, second generation, whether it's immigrating from Mexico or from the Northern Triangle areas, we have to be aware of the nuances and how we ask questions. And these are just several different questions of how do you think, how can I reword this in order to be more culturally sensitive? I really want to draw your attention and thank our director, Dr. Carrion, and Angel Casillas, our project manager, for the Mental Health Technology and Transfer Center support for my work and my presentation. And while I have you guys still, I'm going to go ahead and include my email address here so that if you have questions, I know we don't have a lot of time for questions, but I want to at least give you that access. And then the other thing that I want to share here at the bottom of this slide is our website. It's www.mhttcnetwork.org/Hispanic Latino / and then if you want to email, what I want to share with you all is, as you may know, these centers around the country, 10 of them are 100% funded by SAMHSA, and they are required to do technical assistance and technology information transferring to agencies. So if you don't have a huge budget at your agency and you really need some support, or you need more support in technical assistance around Latino or Hispanic populations, suicidality, gang work, we do immigration stuff. If you go to these websites and you see any of those presentations that you are interested in having us do for your community, for your organization, please reach out to me or to the email address you see here at the bottom, HispanicLatino@mhttcnetwork.org, and you can request a meeting with one of us, and we will do what we can to support you in developing a technical assistance plan and or providing some additional training to follow up on what we've just scratched the surface on today. I want to thank again our host, and I want to thank Constance as I pass it back to you. Constance, thank you for introducing me and for getting us to this point. I'll go ahead and stop sharing my screen. I'm hopeful that folks got this, and please feel free. What I'll do is I'll go ahead and share this with the point of contact I have for your organization, and if you guys want to send this out or posting it anywhere, we're very lucky that this is funded through SAMHSA.
Yeah, I think she got some yesterday. I'm slacking.
Oh, we have someone that we.
There we go. I think I got them there, Constance. I may have muted you also. I'm sorry about that. But as I was saying, we want to make sure that we are able to give you that access. These resources are 100% funded. So if you ever seek out a training from me and I go out, it'll be covered by the center and we can support you all in that. We'd rather be able to train you all in ways that is appropriate for treating this population and help you get to where you feel comfortable and are successful. So with that, Constance, I'll turn it back over to you. Thank you very much.
Thank you so much. You still have people trying to get in. This is just dynamic. I'm going to open up the floor for just a few minutes. If there's anyone who has questions, there have been some comments, but you've read those in the chat. This is a great time just to ask one or two questions before we go.
Yeah.
Raise your hand. You can use the raise your hand reaction or type it in the chat and we'll read it out.
And then also just to read out my email address in case some of you I know sometimes have a hard time with chat. It's drjrocky@gmail. So drjrocky@gmail.com. I look forward to hearing from some of you. Yeah, go ahead, Constance. Sure.
I have a question for you. You know, as it's been highlighted, we are a Hispanic serving institution and also a minority serving institution. What would you say would be one way to attract students, Spanish-speaking students, to a program such as, social work, counseling, human services? What is it? Because I think Dr. Torres mentioned it well. It's under popularized. How do I say that? Where it's not as popular as, let's say, law, right?
Sure.
But it's just as impactful. What would you say
Yeah.
would be some
Yeah,
recommendations?
sure. Great question. I think one thing that I would say is that we have to, and someone highlighted something that I mentioned, which I'm thankful to. Let me see if I can say who mentioned this. Let's see real quick. Um, yeah, someone mentioned just really how we talk about hope, right? And I think that that's one way of infusing in the language. And when I say the language, it's not just the language, the spoken language that we talk, right? It's also in our brochures. It's in the way that we recruit people. It's in the way that we use terminology that is empowering, like conscious, recognizing, right? We're transcending social justice. We're getting into more, because I think that honestly, when we look at criminology, criminal justice especially, that those sort of unfortunately in our society are very oppressive and even profiling in a sense, right? They still continue to teach profiling type of skills. If we can get people involved, and I'm really excited. I've been recruited by a college, a small college here in northern New Mexico, that they're really looking at transforming their criminal justice to a more social justice kind of approach, and really looking at those systems. I think that that's one way, is really using empowering language to make it, I don't want to say sexy, but make it really appealable to those people, that you're empowering them to now become an active voice in us recreating social justice movements. So I think that's one, the language that we use in recruitment, in talking with them. And then unfortunately, the more that we can do to increase potential salaries in the field, right? I think that's always a one area that people that are coming from probably lower socioeconomic statuses already, like many of the students that we see, at least in our region, they are coming to college to try to make a living now, right? And they don't want to necessarily do all this work and then go into a position where they're still barely making it. Now, one thing that I've done a lot around is trying to really present to people that just because you get into the work of human services and social work, doesn't just limit you to that. I've been very blessed in I think the value of my degrees has really allowed me to do a multitude of different things:
Yes,
teaching, research,
yes.
training. So I think really promoting that more is saying, hey, social work isn't just human services and you're just, taking kids from families and doing all that awful work that has to happen sometimes. But you can also now be a community leader. You can go into nonprofits and help them lead a social justice movement. So I think our time is coming. I'm hopeful. I'm hopeful.
Well, I tell you what, I'm going to take this little clip of what you just said and make that a commercial for our program in the School of Human Services. To your point, we have counseling, we have child development, family studies. We have a new program, or a new title, which is Human Services Management and Leadership. It's not new. We've been around for about 15 years, but it
Right.
entails, how do you run a nonprofit? How do you make a nonprofit work? It also entails the clinical aspect of substance use disorder and gerontology and all of it encompasses all of that. But you're so right. So if you don't mind, I'm going to take a clip of what you just said and then
Go
put,
for it.
we are hopeful.
Yeah,
I love
absolutely.
it.
I
I
think the
love
other
it.
piece that I'll kind of end with too, if there's any other questions,
Yeah.
we'll see before we leave. But I think that's the other piece to this, is also um, just recruiting and using that language, like BIPOC, right? Black,
Yeah.
Indigenous, and people of color, using the language like
Yeah.
diversity, equity, and inclusion language, right?
Yeah.
I think those are all kind of those buzzwords that people, I think, at least for myself, um, I'm getting excited. And I've been in the field now 21 years, and
Yeah.
I'm getting rejuvenated again, a
Yeah.
new kind of feeling of hopefulness around these social justice movements. So, Constance, whatever I can do to support you all in the future, if there's opportunities for further dialogue, if there's opportunities for future trainings, you have my info. Please don't hesitate to reach out as well.
Thank you all so much. This has been dynamic, rich information. Thank you so much, Dr. Romero. We're going to release everyone. You can leave this session, go back to your main schedule and click the next class. Thank you again, sir. We appreciate you
Thank
so
you.
much. Take care.
Thank you all. Take care. Peace. Bye-bye.